Good evening, everyone. I am Dr. Jaya Chaturvedi, a gynecologist from India. I traveled all the way to Melbourne, and that is why I am saying good evening. And the conference is converted into virtual and unable to meet you all. So thank you for the opportunity. I'm going to speak on one special application that is developed for the cancer treatment. Innovative support system for ovarian cancer patients leveraging mobile application to enhance chemotherapy tolerance. Just a minute. So, according to the International Agency for Research on Cancer, ovarian cancer accounts for 6.2% of new cancer cases annually, with 36,170 new cases reported each year, resulting in 24,000 deaths. Family history, advanced age, estrogen exposure increase, hormonal replacement therapy are major risk factors for the ovarian cancer. Effective disease control in advanced ovarian cancer can be achieved by a number of therapeutic approaches with high cure rates. Chemotherapy is one of them, with some notable adverse effects. These adverse effects even increase anxiety in ovarian cancer patients. Prevalence of depression and anxiety in women with ovarian cancer has been found to be higher compared to the general female population. These patients may experience less despair, anxiety, and length of hospital stay if they get music therapy as an alternative therapy. In line with this global digital reality, the concept of giving alternative therapy interventions such as meditation, music therapy with assistance of Android application has emerged. By incorporating meditation music therapy features, the application can cater to the psychological well-being of cancer patients. Studies emphasizing the importance of digital innovation in improving quality of life and health outcomes for cancer patients. Nad Yoga is a music therapy. The non-pharmacological intervention like music therapy provide a simple and cost-effective approach, rendering it a viable and pragmatic option for addressing patients' anxiety and depression during treatment. Nada Yoga presents a distinct advantage by offering a treatment option devoid of economic burden or adverse effect. It is a relaxation benefit. Its relaxation benefits are anticipated to mitigate illness severity and anxiety, ultimately enhancing the quality of life for patients. Designing the application to deliver music therapy. Leveraging mobile technologies for delivering accessible interventions has been found to enhance healthcare behaviors in cancer patients, highlighting the potential benefit of such approaches. Additionally, mobile phone technology interventions have been effective in minimizing chemotherapy complication and enhancing the quality of life for cancer patients. There is lack of consumer-based meditation application tailored for cancer patients, indicating a gap that could be addressed by the proposed Android application. Thus, keeping all these things in mind, this application was designed to give the intervention of Nadi Yoga music therapy to cancer patients. A review of literature also favors that whenever the music therapy as alternate therapy is given to the patients who are receiving the chemotherapy, their anxiety and depression levels came down. So I'm not going to read all these review of literature. We have done, and we are doing the study with my PhD scholar. I am the guide and she is the PhD scholar. With the objective was to investigate the potential of Nadi Yoga as an alternative therapeutic approach for managing anxiety and improving the quality of life in ovarian cancer patients undergoing chemotherapy. The objectives were to study the quality of life scores among patients listening Nadi Yoga, study the anxiety scores among the patient listening, and to study the grade of treatment tolerance among patients listening this Nada Yoga. Nada means instrumental music. So material and methods are, in this randomized controlled trial, 58 ovarian cancer patients who were on active cancer treatment receiving chemotherapy were included. After IEC approval. This study was carried out in AIIMS Rishikesh, India from 1st January 21 to 31st July 22. All pertinent information regarding the study was fully explained to the participants. They were also told that an Android application would be used to provide intervention and that it would be installed on their own Android phone. Consent was obtained from each participant just before starting the study. Then the application was installed on their Android to deliver the Nadi Yoga music therapy for 15 minutes daily, starting after first chemotherapy till 12 weeks. 58 patients were initially eligible for the study after a rigorous screening process. These participants were equally randomized into two groups. Throughout the study, 5 participants from Nadi Yoga music group alone and 4 from Nadi Yoga music group with instructions were lost to follow-up. So total 9 patients were lost to follow-up, resulting in 24 participants in one group and 25 participants in the another group. Both groups exhibited homogeneity in terms of age, weight, and clinical parameters. So how this application was given in their Android phone, you can see the application part of this is the screenshot of the Android screen. And here it is the application installed in each patient's phone, that is Nada therapy. In this, a music, my cursor is showing, a music of 10 minutes was installed in this application, which in two groups. In one group, the music was natural up and down music, very soothing, which is increasing in intensity, but it was very soothing music. I'm not going to play because of the time constraint. So this music they were hearing in one group only music, and in another group the music with some instructions that you do like this, you are listening this, you are listening flute now, you should calm down. So such type of instructions were given to the patients. So this is the flow chart. Patients were recruited for the study after the eligibility procedure. Application was installed on their phone. After checking which group they are in, they were given either intervention A, simple music, and intervention B, music with instructions. And then they listened this given Nadi Yoga intervention for 15 minutes daily. And data of that Android application was shared by a researcher through that Android application during each hospital visit. Data collection is done from the Android application whenever the patient came back to the hospital for another therapy or for some checkups. And Android application displayed data indicating that the majority of participants were using it on a regular basis to listen to the Nadi Yoga music. The participants completed anxiety, quality of life, and distress questionnaires developed by the psychiatry persons already verified and validated, both before and after the 12 weeks of Nadi Yoga meditation intervention. Using the Android application to deliver the intervention and maintain precise patient records, regardless of whether the patients are listening to it or not, was really very simple. And this is how we collected the data. The name we shadowed, patient's name, and this Rinku Malik is my PhD scholar. And these are the taken things from their data record, that how many seconds they had listened the music. This mail is from April 1, 2022. During that time, we collected the data. So assessments were done before and after 12 weeks using Hamilton Anxiety Scale and EORTC QLQ C30 Quality of Life Scale. These are already validated scales. And it was fascinating to see the precise data showing whether or not people utilized this meditation application, how many days a week they were listening it, and how much time they were spending listening to the meditation. And measurement tools I already narrated. These were the scales. And the results were really very impressive. Both groups exhibited homogeneity in terms of age, weight, and clinical parameters. Physical functioning, role functioning, emotional functioning, cognitive functioning, and social functioning remained unchanged with no significant differences observed. There was a significant difference in anxiety level between both the groups. A significant difference was found in the global health status of both the groups. In conclusion, the 12 weeks Nada Yoga music therapy intervention offers a cost-effective approach to reducing anxiety and improving the quality of life for ovarian cancer patients. This study highlights the result that Nada Yoga simple music is more effective in ovarian cancer patients than the Nada Yoga music with verbal instruction of meditation. This study showed the potential of Nada Yoga music therapy as a valuable addition to comprehensive cancer care, emphasizing its positive impact on emotional well-being and symptom management. Among the technological advancements, Android applications have emerged as powerful allies, transforming the way healthcare professionals deliver services and patient access medical assistance. By leveraging the advancement in application analysis, security mechanism, and permission management, mobile applications can continue to play a pivotal role in improving healthcare outcomes and patient experiences. These are the authors. The study is going to be compiled very soon, and we presented this paper here, and one more paper we presented from this study in oncology conference in Singapore. So these are my references. Only few references I had taken here. Thank you so much for the quiet listening.